So the next step we will perform will be the recording of the bite registration using our pre-made wax bite rim. So open for me, and we will insert that in the mouth and have the patient close down. And you can see very easily that we're too open, so we will reduce that somewhat initially before we make any measurements. So we will go and we will reduce our bite rim with our torch and spatula. So we're going to get our fox plane. We're going to see if we're nice and parallel with the interpupillary line. I like to use a cotton tip applicator and hold it up to their eye line so that I can see if we're parallel here. We will check our ala tragus line, which we are right on the money. At this point, I like to use this VDO gauge. This is designed knowing that the distance between the corner of the eye and the corner of the mouth should be about the same distance as from the chin to just under the nose. So I will check our sibilant sound. Say that number 66 again for me.
66.
And that is his normal speech. That sounds right. Close together for me. Let's see where we're hitting in the posterior evenly all the way throughout. So now we will remove it, and we will remove some of the posterior wax and make some marks so that the scanner can pick up the wax. We'll make some V-shaped notches into the wax with our lab knife. And while we have our knife handy, we will mark our midline, our high smile line, our canine lines close together for me. I always get a second set of eyes when I'm marking midline. I will get right in front of the patient's face, and I will have her get a little bit behind me. She gives me the thumbs up, so we're going to mark our midline. Always make sure to make it parallel so that the lab knows exactly where to set those incisors. We're going to draw our high smile line right under the lip, taking care not to pinch the patient's lip in the process. They don't appreciate that. And we find the center of the eye, and we mark our canine line. Right, open for me. We'll now put a series of X's onto the wax to give some landmarks for the scanner to pick up so that it's not just smooth wax. About 3 per side looks pretty good here. And now it is time to make our bite registration. Next, we will inject our PVS bite registration material on the lower arch, covering the occlusal surfaces of the lower teeth in the posterior. We do not need to come all the way to the anterior, just the posterior teeth. And a very handy trick, ask your patient, take the tip of your tongue and touch the very back of that plate for me. And close down for me. Perfect. And we'll inject a little bit more so that we get into our V-shaped notches. And press the side of his cheek to make sure that we get inside of those notches. And now we let our bite registration material set up. So now we will trim some of our PVS bite registration material away from our marks so that the scanner can pick it up. We use a lab scalpel, very carefully trim this away. It's okay if it pulls off a little bit. We'll just put it right back in there. We want to try to leave as much of the occlusal surface as we can in the bite registration material. This will help the lab register the bite when they get this. All right, open big for me. And close down, and see he closes right into our bite registration. So now we will do our intraoral bite scan